Hypertension Basics and its basic approach on diagnosis and management. An estimate of 28 billion adults 30-79 years worldwide have hypertension. 46% of adults are unaware that they have hypertension. Less than half of adults, 42% with hypertension, are diagnosed and treated. Only 1 in 5 adults with hypertension have it under control. Hypertension is the major cause of premature death worldwide. More prevalence among men, with increasing age, low-income society, obesity, diabetes, and chronic disease. Hypertension tends to be lower in higher-level education populations. Hypertension, also known as high blood pressure in the general public, is defined as systolic blood pressure, upper number, greater than equal to 130 mmHg, and diastolic blood pressure, lower number, greater than equal to 80. It has various stages. As BP increased, its stages are severe and need additional medication to control. Risk factors for hypertension. Modifiable risk factors: unhealthy diet, physical inactivity, consumption of alcohol and tobacco, being overweight and obese, air pollution. Non-modifiable risk factors: family history, age, coexisting disease like diabetes or kidney disease. Hypertension is also known as a silent killer, as most of us will not have any symptoms, and if symptoms are developed, then we will likely be in the hospital with end organ damage. Some of the symptoms that can be experienced are as follows: severe headache, chest pain, dizziness, difficulty breathing, nausea, vomiting, blurry vision or other vision change, anxiety, confusion, buzzing of ears, nose bleeding, abnormal heart rhythm. Hypertension in 95% is unknown and is known as primary essential hypertension. Only 5% of hypertension are due to secondary causes, which can be diagnosed with some investigations and managed accordingly. The diagnosis of hypertension should be confirmed with at least 2 office readings at different days and time, supplemented by home blood pressure monitoring, also known as ambulatory BP monitoring. It is important to monitor the blood pressure and maintain the blood pressure log so that your provider can have a better idea on your blood pressure and make decisions on how to proceed further. A general myth on public: once BP medication has been started, it needs to be continued for lifetime, which is incorrect. It depends on the cause, and also if we can control the BP properly with lower dose in the long term, we can come off the medication. So it's not always that you will need to be on BP medications. Diagnosis: accurate BP measurement. We should use proper technique and a validated devices, and readings should be average to confirm the diagnosis. Out-of-office measurement. It can help clinician to detect white coat hypertension and masked hypertension. Management: lifestyle modification, weight loss, healthy diet, DASH diet, reduce sodium intake, increase potassium intake, regular physical activity. Do the following: do eat more vegetable and fruits. Do sit less. Be more physically active, which includes walking, running, swimming, dancing, activities that build strength like weightlifting. Get at least 150 minutes per week of moderate intense aerobic activity, or 75 minutes per week of vigorous aerobic activity. Lose weight if you are overweight or obese. Take medication as prescribed by the physician. Keep appointments with healthcare professionals. Don't do the following: don't eat too much salty food. Try to stay under 2 grams of salt per day. And don't eat food high in saturated or trans fats. Don't smoke or use tobacco. Don't drink too much alcohol. 1 drink daily for women and 2 for men. Don't miss any regular medication. Drug therapy. There are various medications for hypertension and should be considered depending on various factors like ethnicity, comorbid medical condition. Nowadays, safe anti-hypertensive medications are available, and poorly controlled blood pressure leads to devastating outcomes like blindness, stroke, paralysis, heart attack, MI, heart failure, kidney failures. So it's always a wise decision to seek medical attention and to visit a physician and start the BP medication as soon as possible. We can reduce the risk of hypertension by reducing and managing stress, regular checking blood pressure, treating high blood pressure, managing other medical condition, reducing exposure to polluted air.